So we'll get you in a garment today and take out your stitches, and probably I won't see you for a couple weeks, you know.
And that next appointment is to just to keep track of it.
Yep, look at how you're healing, how things are coming around. Yeah, the appointments gets fewer and fewer.
Yeah.
Unfortunately. I miss you guys.
Well, in terms of the I've pretty much used up the medication, the antibiotics. I don't need to refill or anything on the medication side. Okay.
No, man, you're getting beyond the curve now.
Well, that's great.
This is good.
Yeah. So just take this whole thing off?
Yeah, let her rip, man.
Is this the last time I'm taking this sucker off?
Maybe. It's like opening up a Christmas package. Yeah, that looks great, man.
Do that?
Mm-hmm. Yeah.
I mean, the flatness is definitely huge.
It's awesome.
Looks pretty good.
Looks great, man. Let's take some stitches out.
Right.
Is this what is it? The iodine, the discoloration? Is that
No,
something
that's just the bruising, just emanating.
You want to be extra careful.
Yeah.
So when I'm in the shower, I'm like barely touching it, and I'm kind of, still kind of shy about.
That's okay, man. I think that's okay. It's all right. The problem when you get a flat chest, it makes this look worse.
I'll work on that. Trust me. Once I get,
Yeah. The other thing, there isn't the stigma of a guy with a gut.
Yeah,
The
beer
chest
belly.
is
You hear it all the
different.
time.
Yeah.
Yeah.
I mean, that's not any. People don't. Men don't have as much problem as that. Yeah, you for the degree of gynecomastia that you had, you're gonna look great. Let's see, in 2 weeks. 2 weeks we'll start talking about the scar management and that type of thing. There's some things we use that I think you should start then.
Okay. So it looks good, huh? You're
Excellent.
happy? Thank you, Doc.
Excellent.
Thank you very much. I feel that quite a bit of relief. It gave me some relief to know that the doctors looked at the progress and feels that it's coming along very nicely. And I would say, that was a big step. This is the first time the doctor has seen it after taking out the bulbs. And so, yeah, I walk out of here even more comfortable than I did walking in here. So.
I feel good. It has been a little over 6 months since the surgery, and I would say from month 3 on, I really felt that I was coming back to normal, and the further away from the surgery, the more I feel that I'm more back to normal. It's like it feels like it's been years since the surgery. In terms of marks and from the blind eye, someone looking at to have no idea that surgery took place. So
tell us about the surgery experience itself.
Well, the anticipation of the surgery is by far the worst part of it. Kind of came to no pain. The nurse was right there. Actually, she said I was making a few jokes right away, and so I felt that I felt pretty good at that point on. And through the support of friends and my girlfriend, in that first week or two, you do have some bulbs in you, and you have some blood flow, and you have to kind of maintain and clean up. And so I think it was great to have people there, especially my girlfriend, to be there to help, because it would have been, I'm sure it would have been a little bit more difficult after doing that on your own. So so with that support and no pain, it was fine. The best part is now knowing that it was completely successful, and I feel good about it, and I look at it and I'm like, that does show a big difference for me. Invited in a few close friends, and both of them have obviously seen me before and right after, and then since then, and I think they're happy. They said it looks good. That was something that they were joking around before. They knew it was kind of something that was part of me, but didn't feel like it was that much of a big deal for me because I never really opened it up. But they definitely, after seeing the difference, they're like, wow, that looks great. And I think having that past now done, and then looking at me in a different light. I mean, I feel like yeah, it's normal. This is the way it should be.
Now as you look at these before and after pictures of you, how does it make you feel?
I mean, they look like breasts. I mean, they from the nipple area just to the contour of it, they just, I would look at it and go, oh geez, is that normal? It's just amazing how much it's changed.
If you today could look at this picture of you before, what would you have to say to that person?
I would say with very little pain, and the right doctor and right strategy about it, and talking it through with people, it would change your life dramatically without a whole lot of risk, really.
Kevin is a remarkable young man and has gone through this experience as well as anyone can possibly go through it. I think he had realistic expectations going in, and I think he's really delighted with the outcome. And I think that his gain in self-confidence and his lack of self-consciousness about his body is really serving him well, and will only continue to grow better as he gets further and further away from the surgery experience and the experience of having breast. I think that he's pretty normal and that he's testing his limits around taking his shirt off, like the first time at the swimming pool with the other guys. I think that that freeing experience is walking out of the shadows of hiding, and that he's just beginning to open up and really relax.
I feel a lot better about my body and stuff. The way it looks. I'm much more comfortable with my chest. Like I said, I'm able to now. I mean, just little things you don't even think about. I'm able to go swimming.
So tell me about this surgery experience.
It went real smooth. I mean, a lot smoother than I could ever think any type of surgery could go. They're Dr. Delgado and his staff, and they're really good at what they do. Got an IV in. The next thing I woke up and I was all bandaged up. And I'd say the worst part was probably when they took the drainage tubes out. I almost passed out or something. I don't know. I started getting all hot. It's like, hold on, and you just feel like this snake thing coming, pulling out of you, and you're like, oh, it's such a different feeling. That's what was probably the most uncomfortable. What I liked about them, they were very sensitive to the condition, very understanding, not only just, the doctor, but the whole staff and everything like that, so, because this is kind of something that's really, really embarrassing to guys.
Do you recognize that picture?
Mm-hmm.
What comes up in you as you see the picture of you before?
I just don't like the way it looks. I don't know. I used to get so angry.
Does that anger come up?
Yep. It makes me mad. I just want to
say more about it.
I don't know. I would get pissed off. That I look like this. To me, anyways, it's remarkable just how much different it is.
What is the feeling that comes up in you as you look at the post-surgery?
Makes me happy. At least, I don't have to wake up every day. I'm concerned about the way my chest looks. I don't know how I can describe it. It's kind of like a life-changing event.
Is there any ways it has changed your life that we haven't talked about?
Everything. It's like I said, it's a life-changing event. It's something that impacts my entire life. Every little aspect of it, everything about my life, it's changed.
David has clearly made a good recovery. I got the sense that he has actually experienced a lot of relief from the gynecomastia surgery, and at least that piece of the shame isn't weighing him down anymore. He's actually made a lot of progress in really being much more open, and in terms of really moving past the shame of that piece of it quite nicely. I think in terms of the gynecomastia, this has been a huge weight lifted off of his shoulders, and it's actually impacted him quite positively.